Hello, I see Dr. Ayeni Sylvester Nutley on. Welcome.
Thank you. I'm so excited. Thank you.
Thank you for being here. I'm going to start in about 2 minutes, so I'll just wait and see if anybody comes on.
Okay, I'm gonna put myself on mute so I don't distract, okay?
Dr. Ek Perry. Okay, Chukwu is here too. Welcome. I'm going to get started in about 2 minutes, just to allow anybody else to come in. Okay, so let's start on time. Welcome to the Power of Mobility webinar, which is going to give you great information on the power of mobility and quality of life and an introduction to Freedom Wellness Physiatry. So you're also going to learn the significance of a physiatrist or a physician of physical medicine and rehabilitation leading the team when it comes to a rehabilitation program. This is in the hospital or at home. And we will discuss the benefits of joining the Freedom Wellness Physiatry experience, and I'll open it up for Q&A at the end. So a little bit about myself. I am Dr. Samantha Benjamin Allen. I am board certified in physical medicine and rehabilitation and founder of Freedom Wellness Physiatry. I grew up in the DC area. I was actually born at Howard University Hospital. So hardworking Jamaican immigrants who came here during the civil rights movement. I have a Bachelor of Science in Biobehavioral Health and a minor in business from Penn State University. And I obtained my medical degree from Philadelphia College of Osteopathic Medicine. And I chose that path because the osteopathic philosophy in teaching medicine is based on a whole person approach. And I think it's very important that we address mind, body, and spirit when we are dealing with people, because we are not just composed of the physical, but all aspects of our being impact our health. So I'm really happy to have graduated from PCOM. So shout out to anybody from PCOM who's on. And I also got my master's in business from St. Joseph's University, which is also in Philadelphia. Then I moved to New York and did my internship in family medicine at South Nassau Community Hospital and found my way back to Maryland to do my residency in physical medicine and rehab at Sinai Hospital of Baltimore. My interests include conservative management of neck and back pain, osteopathic manipulative treatment, which is hand-on treatment to help restore the body's function, which we learned in osteopathic medical schools, spasticity management, stroke and brain injury recovery, as well as musculoskeletal medicine, including trigger point and peripheral joint injections for severe arthritic pain and things like that, if it's appropriate. I also have a background in personal training and completed that certification while I was doing my internship, as I thought it would be a good complement to what I do, because fitness and nutrition are also very important to me. I work in public sector health, and I have expertise in leading teams to manage complex patients by achieving optimal outcomes in both the inpatient and outpatient settings. And some personal things: I am married with 2 beautiful children, and I love spending time with my family, traveling, running, fitness and nutrition, well-being, community service, mission work, and mentoring. So let me tell you about how Freedom Wellness Physiatry came to be. I noticed that there was a gap in the system between illness and recovery when it came to people recovering at home. So I had excellent outcomes with my patients in the hospital setting, both in the inpatient and outpatient field. I worked in the hospital in both inpatient and outpatient medicine, but I realized some people were lost to follow-up, or they could have been doing even much better before getting to the hospital if they had the direction of a physician or someone there in the home setting to help direct the caregivers on what best they could do to help them live optimally and have a good quality of life, no matter their illness, disability, or trauma that they sustained. So what really gave me my aha moment were a couple of experiences that I witnessed. One being my aunt who died from Alzheimer's. She had a very difficult time, getting to appointments, and her caregiver really found it to be a headache to go to an appointment that almost took a whole day, a whole day ordeal to try to get her dressed and convince her to get out of the house, and the pain and the discomfort of the ride and getting there and only getting 15 minutes to see the doctor and not really address the needs that they had or get the questions that they had answered was really a challenge. And then my uncle, who had multiple strokes, also I witnessed the challenges that, family faced in the home setting, trying to get him what he needed and make sure he was being followed up appropriately. And finally, my greatest aha moment was when a friend of mine gave me a call and told me that she was going to take her grandmother out of a skilled nursing facility after she had suffered a ankle fracture, and she was living independently alone, no need for help, driving, getting her groceries, doing everything on her own before she had that slip and hurt her ankle. And she was hospitalized and suffered a complicated hospitalization, ended up with urinary tract infection, and was discharged to a skilled nursing facility because she was not allowed to bear weight on one leg, and because she lived alone, it wasn't safe for her to discharge to home. So the discharge plan was for her to go to the skilled nursing facility and get quote unquote rehab before she went home. And unfortunately, after 2 months of being in that facility, she went from being an independent woman who suffered an ankle fracture to fully dependent for everything. Someone had to bathe her, dress her, turn her, feed her. She ended up with a feeding tube. We call it an NG tube, which is a tube that goes through your nose into your stomach to deliver food, nutrition. And she developed stage 4 ulcers in multiple places, the largest being right above her buttock, that went all the way into the bone. She was so demoralized and declined so rapidly. She was no longer talking. And the only thing she was doing was moaning in pain. She wasn't following commands. So the staff there had told them, she probably is going to need to go on hospice. There's nothing else we can do. And they were very upset because they felt she was neglected there and her outcome was not supposed to be that way. So they said, we're going to take her home. So my friend called me and said, Samantha, I want you to come and take a look at my grandmother and tell us what to do at home to help her, because we don't know what to do next. And after I heard how long she had been in that facility, I really didn't know what I was going to walk into. And I prayed and I said, Lord, if there's anything I can do to help them, use me to help them help her get better. So I went in there, I assessed her, I did, the same thing I would do in the hospital setting when I would see a patient. I did a full history and, examined her, looked at her wounds, and I gave them a written treatment plan of what to do at home daily to help get her better. And in 6 weeks, this woman was sitting up at the edge of the bed without support. She was engaging in conversation. She was following commands. She started taking food by mouth. The large wound that she had on her sacrum was almost closed. And then I said, this is what we need. We need someone to help meet people where they are. And if people could have a physician who comes to the home and assess them, especially if it's a severely debilitated person who cannot get out of the house very easily, and give them the time and the attention that they need, things could be much better. The life that they live, even in their latter years, does not have to be full of suffering and pain. So that's how Freedom Wellness Physiatry came about. And our vision is to see patients live in the freedom of accomplishing their daily needs and goals despite their disability or physical limitations, with forward momentum towards a life of wellness and purpose. Our mission is to help patients realize their potential despite their circumstances through inspiring hope, coupled with knowledge and skill in delivering excellent physical medicine and rehab care that is holistic, personalized, and comprehensive. We serve adults in the DC metro area by making house calls within a certain radius, and anything outside of that radius, we can make exceptions for on a case-by-case basis. Why does the population we serve matter so much? So according to the US Census Bureau, the middle-aged outnumber children, and by 2034, the country will reach a point where older adults will edge out children in population. So people age 65 and over are expected to number 77 million, while children under 18 will number 76 million. So our population is aging, and the need for support at home is very important, because a lot of people will be depending on their children to help care for them at home if they don't go to assisted living facility or some type of senior care community where they can get the help they need. And there are a lot of people who want to keep their family members home, but they don't know how to do it. And if given the support, the resources, and the help to do it, they can do it successfully. Why is mobility important? If you follow me at all, you see my inspiring mobility posts, and I believe mobility is vital to our well-being. And an elderly patient typically spends a staggering 83% of the time that they're hospitalized lying on their back. And there was a study by Brown and colleagues where wireless accelerometers were attached to hospitalized seniors, and it was found that they only spent 3% of their time standing or walking. Bed rest in and of itself is associated with numerous adverse outcomes, many of which we're trying to prevent, like pressure ulcers, DVTs or blood clots, and functional decline. And hospitalized seniors lose up to 5% of their muscle strength daily. They're 6 times more likely to be discharged to long-term care facilities and 34 times more likely to die in the hospital. And in one study, 800 out of 2,300 of hospitalized elderly patients were discharged with hospitalization-associated disability. So a lot of times people are hospitalized and they come out 10 times worse than they were before they went to the hospital. And this is not what we want. We want people to be doing better. And we don't want them declining once they get home, or to just put a patch on things and then they go home and, you know, the caregivers or the support that's there is lacking. And we want people to thrive long after they are discharged from the hospital. Now, some other reasons why mobility is important: just know that our strength can decrease 20 to 30% with 7 to 9 days of bed rest. And 5 to 10% of muscle mass is lost per week. 5 weeks of total inactivity costs 50% of previous muscle strength. So you can lose 50% of your muscle strength in 5 weeks of inactivity. And only 1 contraction a day at 50% of maximal strength is enough to prevent that decrease from happening. Lack of stress and tension on the bone through weight bearing and muscle pull causes osteopenia, or decreased bone density. So bone becomes brittle when there is no mobility or tension on the bone, like with walking. So it's very important that we mobilize people even when they are too sick to move, by doing passive range of motion and exercises with them, so that when they do get to a point where they can move, if they happen to bump themselves or fall, they're not as prone or higher risk of getting fractures, which are very detrimental in the elderly. Now, the detrimental effects: bone loss begins 5 to 6 days after your mobilization, and it peaks at the 2nd week. So within 2 weeks, you can have peak in your bone loss from your immobility. And upon resuming activity, normal values in calcium are achieved in 6 weeks. Redistribution of body fluids leads to postural hypotension. So that's when you see people who drop their blood pressure drastically when they change position. And as a result of immobility, our blood pools. So you can think the blood kind of rests in our posterior or our backs, our bottoms, our legs. And when you change position after being immobilized for so long, your body doesn't have the ability to increase your blood pressure fast enough to get that blood to your brain so that you can sustain your posture. And then you have a rapid heart rate, which is what we call increased sympathetic activity. And a rapid heart rate does not allow us to efficiently pump blood throughout our body because each contraction is not as strong. And therefore, you decrease your stroke volume and your oxygen capacity. You develop pulmonary issues. You see a lot of people get pneumonia when they're immobile for too long. And that's all related to the immobility. Now, in addition, you can have decreased GI motility, meaning simply you can get constipated because mobility encourages our digestive system to be active and helps us to excrete waste more efficiently. So in addition, people have loss of appetite from the constipation because there's nowhere for the food to go if they haven't moved their bowels in multiple days. They just don't feel hungry. And then urinary stasis leads to increased risk of urinary tract infections. And I already mentioned pressure ulcers to you, which is another result of immobility because the skin atrophies, it becomes weaker or the integrity decreases. So it's easy to bruise and easy for skin breakdown to occur, which can result in pressure ulcers, which can become infected. So it is a downward spiral when people are not moving. Now, why is it important to have a physical medicine and rehab physician in the team approach to helping someone live their best life when it comes to trauma, illness, or disability? Our goal of treatment is to restore function and mobility to those suffering from disability or physical impairment. And we often work closely with physical therapists, occupational therapists, speech therapists, nurses, psychologists, and other providers to help optimize health outcomes in a more efficient and holistic manner. Now, according to the research, among Medicare beneficiaries who are eligible for post-acute care at home, meaning after discharge, or in skilled nursing facility, discharge to home with home health was associated with higher rates of readmission. So even when someone leaves the hospital and they get home health, it doesn't mean that their outcome is any better. And what's missing from that home health equation is the physician in physical medicine and rehab, which is what is part of the team when they're in an inpatient rehab setting. And that's not in the equation when they're at a home rehab setting. So the mortality and functional outcomes actually have not shown to be any better. And a lot of times, therapists might come to a situation where a patient looks like the one I described to you at the beginning of this presentation and say, we don't really have anything to do with this person, which is not true, in fact. But if there's someone directing that program or even that home health team and holding them accountable for what they need to be doing on a regular basis, the outcomes can be much better. Now, outside of hospital setting-based multidisciplinary rehab does lead to improved mobility in older patients 3 months after their discharge. So that's something to think about. And overall, the costs are much lower. So the system actually is less burdened by costs when a physical medicine and rehab physician is involved in the care beyond the hospital. Now, a 6-minute walk distance test is something that we use to measure patient progress. And patients receiving rehab walk an average of 23 meters more than the controls or the people who did not have the rehabilitation program. And hospital at home programs that enable patients to receive acute care at home have proven effective in reducing complications while cutting the cost of care by 30% or more. So here are some important questions to ask your insurer, and this is for anyone. It's important to know this because if for any reason you are hospitalized and rehab would be of benefit to you, you want to know what they cover. So you want to ask how many days of acute inpatient rehab they cover. You want to know how many days of home health therapy they cover, and you want to know what DME or durable medical equipment they cover. That's like canes, walkers, raised toilet seats and things like that. Now, I want to leave you with a wellness prescription, and this is for anyone. Always clear any advice you get with your own doctor because some things might not be advisable given your condition. But these are some things to keep in mind and to try to achieve in your daily life. So you want to drink 2 liters of water daily. And I always advise that you have a personal water bottle with measurements on it so that you can monitor your daily water intake. It works much better than having random water bottles that you're sipping out of or trying to get enough cups in a day. It's very hard to keep track of how much water you're drinking when you do it that way. So have a personal water bottle that has measurements on it so you can monitor your daily intake. You want to get enough sleep. Sleep is very important for our bodies to rejuvenate and restore from the daily stressors that we face. And this is when our brains, heal and when they can come up with all the creativity that keeps us enjoying life. So you want to sleep 7 to 9 hours a night. And you also want to nourish with rest. There are multiple types of rest. And I'm just going to touch on them briefly, but there's spiritual rest. So it's important that you have spiritual rest on a daily basis, sitting in the quiet, enjoying the presence of your creator. If you are someone who prays and meditates, try to do that daily. And whatever your spiritual practice is, try to be consistent with it. It's very important to our well-being. The next thing is creative rest. So things like painting, drawing, dancing, these things actually enhance our well-being, and they help us feel good, and they help us use our right brain, which is our creative thinking side. And a lot of us are left brain people, and we don't really engage our right brain. So creative rest is also important. Mental rest. So you want to avoid stressors. Think of the things that stress you on a regular basis and be conscious about taking time to separate from that so that you can have mental rest. If you're a person who works on the computer all day, set time to say, I'm not touching the computer, or I'm not engaging in screen time for these many hours. Be intentional about it. Emotional rest. We are always getting sensory input, the news, social media, all these things that can trigger emotions in us that aren't always positive. You want to dose that as well. There are people who tend to drain us, and there are people who tend to fill us up. If there are people that you know that you feel depleted after you engage with them, dose your time with them. Do not put yourself in a position where you're constantly being drained because you're around people that drain you emotionally. Situations that we have in our day-to-day can emotionally drain us. Take time out for yourself so that you can recharge. Social rest. This ties in with emotional rest, but social rest goes back to being around people that enhance your well-being or your mood. There are people in our lives sometimes where we just feel like when we're in their presence, we feel peace. When we're in their presence, we feel joy. So make sure you prioritize time to spend with those people you enjoy spending time with. Life can be so busy sometimes that we don't see people for months that we enjoy the company of. Be intentional about that. And then physical rest. Physical rest is not just sleep. Sleep is passive rest, but there's also active rest. So things like yoga, stretching, even exercise, yes, is a form of physical rest. It raises our endorphins, it decreases our stress level, and it loosens our muscles. So just make sure that you also do active physical rest with passive rest, and make sure you stretch after your exercise routines. You want to have 2 to 3 servings of fresh fruits and vegetables a day. Maybe in the morning you can cut up an apple, an orange, and a banana. That's 3 fruits right there in a fruit bowl in the morning. Then you want to do the same thing for vegetables. You can cut up some celery or carrots, use hummus or some other dip that makes it more palatable for you if you don't really like fresh vegetables, but you want to have 2 to 3 servings of each of those daily, or even more if you can. Actively address areas of brokenness in your life. So grief, hurt, resentment, anxiety, trauma, depression, unforgiveness, all of these things do hinder us from living our best life, and they actually can contribute to poor health. It's linked to diabetes, it's linked to high blood pressure, these things that we carry. So prayer and counseling is very important. So therapy is a major aspect of helping us to overcome these things that we struggle with, sometimes of which we don't know what the underlying cause of them are. And therapy can help us, draw those things out and heal from them. You want to avoid or minimize alcohol and caffeine use. Favor prepared meals over processed foods and eating fast food. So it's better for you to bring your lunch from home than to buy it out on the street. I know sometimes when you're busy, that's the easiest thing to do, but try to be more intentional about preparing your meals. And then exercise for 45 minutes, 4 to 5 days a week at moderate intensity. Now, I want to give you a little equation to help you when it comes to what moderate intensity means. So in the medical world, we use this equation where we take 220 minus your age, and that result is going to be your maximum heart rate. You don't want to work out at your maximum heart rate. We don't want you passing out. You want to do 60 to 70% of that, which would be moderate. So take that number that you get when you do 220 minus your age and then multiply it by 60 or 70%, depending on the intensity you want to start with. And that outcome is the number that you would set as your goal when you do your workout. So when you're done, you want to check your pulse, put these 2 fingers on your carotid, and see how many beats you got in a minute to see if you reached that intensity goal. And you might not get it the first time you start working out if you haven't worked out in a while, but that's the goal that you're aiming for. And you want to weigh in weekly to make sure that you are maintaining a healthy weight or moving towards getting to a healthy weight if you're trying to lose weight. If you don't do that on a regular basis, the pounds can just rack up, and it's very hard to lose them when you've gone too far. So just be mindful of those things. Now, benefits of working with Freedom Wellness Physiatry. My practice is going to give you direct access to a physical medicine and rehab physician without waiting for a referral, not having to worry about denials from your insurance company. There are membership discounts, so you can do 6-month membership or 1-year membership, or you can choose to pay as you go. Obviously, you're going to get the best benefit from doing membership. Now, there are no long waits for appointments. You can get in within the week that you make the appointment, and there are no hidden fees, so you'll always know what you're going to pay up front, and you will have extended time with your physician. Like I mentioned, a lot of times you'll go to a doctor's office and maybe get 15 to 30 minutes if you're lucky, because the system is structured in a way that physicians have to see a lot of patients in a short amount of time, to survive and meet the requirements of the system that they're working under. So in this model, it does allow you to have the extended time to ask your questions and ensure that you're getting the quality of care that you deserve and you need. Now, the cost for membership, 6 months, is $12.24. That includes an initial consultation and 5 face-to-face follow-ups. And 1-year membership is $21.99, which includes your initial consultation and 10 face-to-face follow-ups. Pay-as-you-go prices are listed below, and any of these options are available to you. Some of our services include physician house calls, as I mentioned, telemedicine follow-up, appointments for convenience, though I always prefer in-person visits, therapy referrals like physical, occupational, speech, neuropsychology, if appropriate, rehab-related prescriptions, equipment, pain management, therapy referrals, osteopathic manipulative treatments, injections, trigger point, spasticity, or peripheral joint injections, which I mentioned earlier, and patient advocacy. This is major. As I mentioned, a lot of times people just don't know where to go, what to ask, what they need. And as a physician, I can advocate for those needs and be that person who calls. And when they say push one if you're a physician or a hospital, I'll do that and get you in, get your questions answered and get what you need expediently. And counseling for navigating the healthcare system to meet your needs. I also offer consulting to educate health agencies on how physiatrists can be a great asset in evaluating, assessing, planning, and implementing an individualized rehab program for their patients. So that is it. I thank you for joining. If anybody has any questions, please ask. You can raise your hand and I'll unmute you.
Yes, thank you. That was an excellent presentation. I do have 2 questions. I know you said you're based in the Maryland, DC area. Anything around the New Jersey, northern New Jersey, New York area? And any options for like patients that have Medicaid and Medicare in this area? Thank you.
You're welcome. That's a great question. There are no options for insurance. So Medicare and Medicaid are not accepted currently, though this is something we may explore in the future. So we encourage anyone who has insurance to keep their insurance because it's still beneficial if you're hospitalized, or if I give you a prescription for equipment, your insurance will likely cover it. And after a consultation or visit, I'll always leave you with your note with the codes and everything you would need to submit to your insurance to see if they will reimburse you. But it's not guaranteed that they will, and we don't run based on insurance. So there is no acceptance of insurance currently, but this might be available in the future. And your second question about anything in the New Jersey area, we do not have anything in that area right now, but with expansion, that is certainly a possibility. So when
Awesome.
that happens, I will let you know. But right
Thank
now, just covering the DC, Maryland, Virginia metro area. Any other questions?
Yeah, I have my hand up. I'll lower my hand now. So so now I noticed I don't know if you could go back with the pricing model that you have.
Sure, give me 1 second. Okay.
So the 6-month membership, it says initial contact and five face-to-face follow-ups. What if you find that the patient may need more than that? Is there a discount within that 6-month period? Is there a discount on the face-to-face follow-up for memberships? Or do they default to the $225 after they've used up the 5 for that 6-month follow-up?
Yes, after the visits in the membership have been exhausted, then it defaults to the regular pricing, the pay-as-you-go pricing.
Okay. And then what would be an indication where telehealth virtual follow-up would be more appropriate for a patient versus a face-to-face? I know it's your preference for face-to-face, but when would you say, okay, this patient is in a place where telehealth is more appropriate?
Telehealth appointments are more appropriate once a patient has reached a goal or a steady point that wouldn't warrant a face-to-face, because I might not be measuring your distance on a 6-minute walk test in that interval, or I might not be doing something that requires me to see you in person, where I'm testing your range of motion, or certain goals or outcome measures that I use to see how you're progressing. If we've reached a point where you've graduated enough that now we're trying to maintain, that might be more appropriate in a telemedicine visit. Or if a caregiver wants to do a visit more so to ask questions or to show me something, sometimes if it's a wound or a device and they just want to show me what's going on with it and want some advice or some direction on what to do, sometimes that might be easier for them. But in person is always the best, especially when it comes to demonstration and measuring outcomes.
Okay. My last question is related to working with, I don't want, like in family medicine, we have mid-levels or other other specialties or mid-levels or advanced practice professionals. In your field, it would be PTs, OTs, and speech therapists or STs. So you did make a mention of how the outcomes are not as desirable or as one would expect when you're working just with the PT, OT, and ST versus having a physiatrist leading the team in a home health setting. This is news to me. As a family medicine provider who worked primarily outpatient until recently, or even as right now as a person who's doing inpatient medicine, we always, have the physical therapy assess them, oh, they're okay for home health, discharge with home health. But if we're not, with the goal is that they don't come back, right? That they're not being readmitted.
Right.
How do you plan to educate your fellow colleagues like myself, as well as finding better ways to partner with maybe home health agencies that work with PTOT, so that you will be able to have better guidance with their programs that they're developing for individual patients that are coming out of the hospital, to ensure better outcomes? Because again, like, we all know that the best place to heal is at home, but we want to do it safely, optimally. So
exactly. That's an excellent question. So part of what I do in my practice is to educate home health agencies, and it's on an organic level. So the impact is a little difficult to get everywhere, which is part of why I do videos, because I can reach more people that way. But I would say, as a provider in family medicine, or any provider who tends to refer people to home health, give them a referral also for a physical medicine and rehab physician in their area, so that they can help to direct that program. Because what I find a lot is a home health agency doesn't have a physician helping in that direction and the treatment program development for patients. So the accountability is lacking, and there are times when a therapist might prematurely discharge someone, or come in one time and say, I don't think there's really much we can do here. And I think if there's a physical medicine rehab physician who's part of that experience, even if they're not working with the home health company or agency, they can help to write the plan or give the direction to make sure there's someone following direction from a physician and being supervised, so that they can be the ones to follow up and say, okay, you're making the progress you need to make, or we need to revise your rehab program. Tell them to do XYZ exercises with you. And then when you come back, we'll see if it's working better for you.
Okay. That's interesting. And the last question is about payment again. What type of payments do you accept? Is it like, how do they pay
Yeah,
you?
I got you. So if you go to the website, you can pay directly there.
Okay.
And the other options are in person. So we have a Stripe terminal that you can just pay, at the visit. And we also accept checks. So those are the main options. So any major credit card or checks is the payment we accept.
Okay. All right. Well, that's all I got.
Well,
Very
thank you.
presentation. Really informative.
Wonderful.
We'll have
Well,
to
I
direct
hope
more
it's
people
something
to
you can
yours.
take with you as you continue caring for patients. And I'm glad to have you guys here.
Yeah.
And hopefully we will meet again soon.
Yeah. All right. Thanks.
Take care. Bye-bye.
Bye-bye.